IVF is in vitro fertilization. It is done for the more severe forms of infertility, dealing with severe forms of male factor, which means low sperm counts, low motility, poor sperm function. It means dealing with women that are older or have poor egg quality, whether it's due to age or polycystic ovarian disease. And it's for couples that have tubal disease or other pelvic disorders, endometriosis, things of that nature. In some cases, it's very useful for couples that have failed other treatments, whether they have failed surgery, they failed inseminations or IUIs, and in some cases for idiopathic or unexplained infertility, where we may not know why they're not getting pregnant. We simply try to optimize their chances by doing IVF. The process involves really several steps, where there's the evaluation by checking the male and the female for underlying problems to determine who needs to do IVF and why. We do a battery of endocrine tests. We check the uterus for anatomical problems. So that's the evaluation portion of it. Then there's a preparation phase where we are putting the women on birth control pills to turn off their ovaries and get the ovaries ready for IVF. The nurses meet with them for about an hour to teach them about their drugs, their protocols. They sign consents, and questions are answered. The doctor has already done an IVF consultation explaining all the steps with the patient. And then ultimately the IVF cycle itself, that's the labor-intensive part, because we spend 2 weeks of fertility drugs stimulating the ovaries, doing an egg retrieval to remove the eggs, fertilizing them in the laboratory, watching the growth and development of embryos to pick out the best embryos, and then ultimately the embryo transfer allows us to put a limited number of embryos directly where we want them to be in an idealized uterine lining. And that's what the process of IVF is all about. The success rates with IVF are very clearly related to the woman's age more than anything else, because that dictates the health of the embryos. And then there's, of course, male factor issues, genetic issues. But, for example, a woman who's between 30 and 34 years of age has a 50 to 70% success rate. A woman who's in her late to mid-40s, 42, 43, 44, may have less than a 5% chance of success. Things that we have no control over. So age is still very critical as a determining factor for IVF. The results are life-changing, because I've had the beauty of having been in this field for over 30 years, and I've seen the improvements that have taken place over many decades, and we are able to help the majority of our couples. And that is truly life-changing. Becoming a parent is life-changing, and so many of these couples who have been struggling for years to be able to hold a baby and know what they've gone through to get to this point is amazing.